Video 67, Facilitation Skills Area 6, Chess Subcompetencies 6.4.1. Review the learning objectives for this video. Welcome to this video on facilitation skills. I am so glad you are here because facilitation is one of those essential abilities that will truly transform the way you work with groups. Facilitation is a distinct skill set that every health educator needs to master, and it is important to understand how it differs from presentation and lecturing. When you present or lecture, you are the primary source of information. You deliver content and the audience receives it. The communication flow is largely one-directional from you to them. When you facilitate, your role changes fundamentally. You are no longer the primary content source. Instead, you are a guide who structures the environment, asks strategic questions, and helps group members learn from each other and from their own experiences. The communication flow is multidirectional, moving between group members with you steering the process. A facilitator's core tools are questions, not answers. You ask open-ended questions that prompt reflection, challenge assumptions, and draw out diverse perspectives. You create space for quieter participants to contribute while ensuring that dominant voices do not monopolize the conversation. You manage the energy and focus of the group to keep discussions productive and on topic. Why does this matter for health education specifically? Because behavior change is deeply personal and contextual. When participants in a smoking cessation group hear another group member describe how they overcame a specific barrier, that peer experience can be far more persuasive than any expert lecture. When community members collectively brainstorm solutions to a local health problem, they develop ownership over those solutions in a way that externally imposed programs cannot achieve. In practice, effective health educators move between facilitation and presentation depending on the learning objective. Knowing when to switch between these modes is a hallmark of skilled health education practice, and it is a skill you are well on your way to developing. Every facilitator encounters difficult participants, and how you handle them directly affects the learning experience for the entire group. Let us walk through the 4 most common types and evidence-based strategies for managing each, because being prepared for these situations is going to boost your confidence tremendously. The first type is the dominator. This person talks frequently and at length, often answering questions before others have a chance to think. They may not realize they are monopolizing the conversation. To manage a dominator, implement structured turn-taking by going around the room in order. Set clear time limits for responses, such as please share one key thought in 30 seconds or less. You can also use techniques like think, pair, share, where everyone first writes their thoughts individually before sharing, which prevents the dominator from jumping in immediately. The second type is the side conversationalist. This person engages in private conversations with neighbors during group activities, which distracts nearby participants and signals disengagement. The least disruptive strategy is to physically move closer to the side conversation while continuing to facilitate, which usually causes the conversation to stop naturally. If it persists, assign the individual a specific task or direct a question to them by name. The third type is the silent observer. This person never voluntarily contributes to group discussion. Silence does not necessarily mean disengagement. It may reflect cultural norms, introversion, language barriers, or uncertainty about whether their contribution is welcome. To draw out silent observers, use small group work of 2 to 3 people, which feels less intimidating than speaking in front of a large group. Have participants write their responses on cards before sharing verbally, and directly but warmly invite participation by saying something like, I would love to hear your perspective on this. The fourth type is the challenger. This person frequently questions the facilitator's credibility, disputes presented information, or debates other participants aggressively. The key strategy is to acknowledge their concern without getting defensive. Say something like "that is an important point, and here is what the research shows." Then redirect the conversation back to the learning objectives. If the behavior continues, offer to discuss their concerns during a break to protect the group's time. You are going to encounter all of these types at some point, and now you have practical strategies ready for each one. Beyond managing individual difficult participants, effective facilitation requires understanding and shaping group dynamics as a whole, and this is where you can really make your sessions come alive. Group dynamics refers to the social processes and interactions that occur when people work together. These dynamics can either enhance or undermine learning, and the facilitator plays a crucial role in steering them in a positive direction. The first strategy is to establish ground rules collaboratively at the very beginning of your session. Rather than imposing rules from the top down, ask the group what guidelines they need to feel comfortable participating. Common ground rules include respecting different viewpoints, maintaining confidentiality about personal stories shared in the group, allowing one person to speak at a time, and putting phones on silent. When the group creates these rules themselves, they feel ownership and are more likely to follow them. The second strategy is to monitor group energy throughout the session and respond to what you observe. If energy is dropping, introduce a movement activity, a partner discussion, or a brief energizer. If the group seems confused, pause and check understanding before moving forward. If emotions are running high around a sensitive health topic, slow down and create space for processing. Being responsive to the room is what separates an excellent facilitator from someone who simply follows a script. The third strategy is creating psychological safety through inclusive facilitation. Use language that welcomes diverse perspectives. Avoid jargon or acronyms that might exclude some participants. Acknowledge that health topics can be personal and sensitive. Ensure your examples and scenarios reflect the diversity of your audience in terms of culture, age, gender, family structure, and life experience. When participants feel psychologically safe, they are more willing to share honestly and engage in meaningful learning. The fourth strategy is summarizing key discussion points before transitioning to a new topic. When you summarize, you validate contributions by showing that their input matters, and you reinforce the most important learning points for the entire group. These are skills that get better with practice, so be patient with yourself as you develop them. Every session you facilitate is an opportunity to grow, and I have no doubt you are going to become an excellent facilitator. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is C. Option C addresses both problems simultaneously using established facilitation techniques. Written individual responses prevent the dominant participant from jumping in first, and the pair sharing format creates a lower pressure environment for hesitant participants to contribute. Option A allows the imbalance to continue, diminishing the group learning experience. Option B puts quiet participants on the spot and could create embarrassment. Option D abandons the group format entirely rather than applying facilitation skills to improve it. Summarize the key